that. And scientists analyzing breast cancer numbers discovered an interesting finding. Breast cancer death rates vary across the country.
The early 90s, the American Cancer Society is noticing a troubling trend, a rise in cancer deaths.
Concerning trend involving the number of young women being diagnosed with stage 4 breast cancer.
Did you know that 1 in 8 women will develop breast cancer in their lifetime? That's right, it's not just a rare occurrence, it's more common than you might think. Trust me, these next few minutes could be the most important of your year. Hey there, health warriors. Welcome back to our channel where we're all about empowering you with knowledge to live your best, healthiest life. Now, before we jump in, let's hit you with some mind-blowing stats that'll really put things in perspective. In 2022 alone, over 2 million new cases of breast cancer were diagnosed worldwide. That's more than the entire population of some countries. But here's the kicker that'll give you hope. When caught at stage 0 or 1, the 5-year survival rate is nearly 100%. That's why knowing these early signs isn't just important, it's absolutely crucial. So top off that mug, get comfy, and let's get started on this potentially life-saving journey. You should wait for number 1, as it might just be the saving grace you need. 8. The sneaky lump. First up, we've got the classic sign that most people are familiar with, a new lump or mass. Now, I know what you're thinking, but doc, my breasts feel lumpy all the time. And you're absolutely right. Breasts can be naturally lumpy, especially around your period. It's like a topographic map in there sometimes. But we're talking about a new lump that wasn't there before. It's like if you suddenly found a new island on that topographic map, that's when you need to pay attention. Here's a fun fact that might surprise you. Not all cancerous lumps feel the same. Some might feel hard and painless, like a frozen pea under your skin. Others could be soft and tender, more like a water balloon. And the size can vary too. It could be as small as a pea or as large as a golf ball. The key here is to get familiar with your girls through regular self-exams. Think of it like learning a new language. The more you practice, the better you'll get at noticing when something's off in the conversation. 7. The shapeshifter. Next on our list is changes in breast size or shape. Ladies and gents, because yes, men can get breast cancer too. Our bodies change all the time. We gain weight, we lose weight, we age. All of these can affect our breast shape and size. But if one breast suddenly decides to go rogue and change shape or size while the other stays the same, it's time to pay attention. Imagine your breasts are like your favorite pair of socks. If one suddenly looks different from the other, maybe it's stretched out or shrunk in the wash, you'd notice, right? Same principle applies here. These changes can be subtle, so don't expect anything dramatic like suddenly waking up with one breast twice the size of the other, though if that does happen, definitely get it checked out. We're talking about more gradual changes that you might notice over time. For example, one breast might start to look more elongated or flattened, or maybe the contour changes with a part of the breast sticking out more than it used to. Sometimes it might even feel heavier or firmer than the other side. 6. The skin game. Now let's talk about skin changes. Your breast skin should be as smooth as a baby's bottom, right? Well, not always. But if you notice any puckering, dimpling, or redness that wasn't there before, it's time to get it checked out. Think of it like your favorite fruit. If an apple suddenly developed a weird texture or color, you probably wouldn't eat it. Same goes for your breasts. Any unusual changes deserve attention. Let's break down these skin changes a bit more. Puckering or dimpling, redness, thickening, scaling or flaking. Remember, these changes don't always mean cancer. Things like eczema, infections, or even just dry skin can cause similar symptoms, but it's always better to get them checked out, just to be sure. 5. The nipple nuisance. All right, time to talk nipples. They're not just there to look pretty or feed babies, folks. They can actually give us important clues about breast health. If your nipple suddenly decides to play hide and seek by turning inward, we call this inversion, or if it starts to look different in any way, it's time to chat with your doc. And here's a tidbit that might surprise you. Nipple changes can be one of the earliest signs of breast cancer, sometimes showing up even before a lump is felt. Now, it's important to note that some people naturally have inverted nipples, and that's totally normal. What we're looking for are new changes. If you've always had outy nipples and one suddenly becomes an innie, that's when you need to take notice. 4. The leaky faucet. Last but not least, let's discuss nipple discharge. Now, if you're pregnant or breastfeeding, some discharge is normal. In fact, it's expected. But if you're not, and especially if the discharge is bloody or only coming from one side, it's time to get it checked out. Think of it like a leaky faucet in your home. A little drip might not seem like a big deal, but it could be a sign of a bigger problem that needs fixing. Here are some characteristics of nipple discharge that you should pay attention to. Color. Discharge can be clear, milky, yellow, green, or blood-stained. Texture. Is it thick or thin, sticky or watery? Smell. Does it have any odor? Spontaneous or expressed? Does the discharge happen on its own, or only when you squeeze the nipple? One side or both. Discharge from both breasts is less concerning than discharge from just one side. Remember, nipple discharge can have many causes, most of which are not cancer. Things like hormonal changes, certain medications, or benign growths can all cause discharge. But because it can sometimes be a sign of breast cancer, it's always worth getting checked out. 3. The armpit alarm. Did you know your armpits can be a warning sign for breast cancer? I bet that's not something you think about every day when you're putting on deodorant. But here's the thing, breast tissue actually extends up into your armpit area. Doctors call this the tail of the breast, and it's a part that we often forget about. So, a lump or swelling in your armpit could be related to breast cancer. It might feel like a small, pea-sized lump at first, or it could be a larger, more noticeable swelling. Now, before you start panicking every time you feel something in your armpit, remember that there are lymph nodes in that area that can swell up for all sorts of reasons, like if you have a cold or an infection. But if you notice a lump or swelling that doesn't go away, especially if it's only on one side, it's definitely worth getting checked out. So next time you're doing your deodorant dance, give your pits a quick feel too. It's an easy way to incorporate a little extra awareness into your daily routine. 2. The breast ache. Breast pain isn't usually a sign of cancer, but in some cases, it can be. If you're experiencing persistent, unexplained breast pain, especially if it's only in one breast, it's worth getting checked out. Now let's be clear, breast pain is super common and can be caused by all sorts of things. Your menstrual cycle, hormonal changes, an ill-fitting bra, or even just sleeping in an awkward position can cause breast pain. In fact, up to 70% of women experience breast pain at some point in their lives. But here's when you should pay attention. If the pain is severe and doesn't go away, if it's only in one specific spot, if it's accompanied by any other symptoms we've talked about, remember, breast cancer usually isn't painful, especially in the early stages. But some women do experience pain as a symptom, so it's not something we want to completely ignore. 1. The silent culprit. Now here's the plot twist that might blow your mind. The most common sign of breast cancer is actually no signs at all. Yep, you heard that right. Many breast cancers are detected through routine screenings before any symptoms appear. This is why regular mammograms are so important, especially after age 40. It's like that old saying, the absence of evidence is not evidence of absence. Just because you can't feel or see anything unusual doesn't mean everything is perfectly fine. That's why regular screenings are so crucial. And that's a wrap, health warriors. If you found this video helpful, don't forget to give it a thumbs up, share, and hit that subscribe button for more health tips.